And now it's Boomer Life. Lifestyle ideas designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life.
Nice to have you with us this Friday evening. I'm Sterling Fox, joined in studio by Dr. Lawrence Chen, who is, Dr. Larry does all sorts of things. He's a chiropractor, he's an acupuncturist, he is a naturopathic physician, and he is also one of the founding members of the Integrative Naturopathic Medical Center on West Broadway in Vancouver. And we were talking during the break, Dr. Larry, about Boomer Life. This program is very popular with AM 650 listeners, and most of them who listen to the program are boomers, which means we've reached a certain point in our lives where we grudgingly begin to recognize, Dr. Larry, that, well, our human condition is changing, and in some cases, regrettably not for the better. It's called aging. And, you know, whether you're a naturopathic physician like yourself, sir, or a traditional medical doctor, aging is an inevitable process, isn't it?
It is absolutely that, and as I definitely I'm a boomer as well, and I'm hitting that spot where my wife said to me, better study more about anti-aging medicine as well because it'll help a lot. So
okay. Now, is there such a thing? I mean, you see these commercials on TV, especially the long 3-minute jobs on the late show. But, you're supposed to get some cream online and it's going to make you look 26 again and all of that. Is there such a thing as anti-aging from a medical or a pharmacological point of view?
Well, I think just the nature of the fact that when I first started looking into the medicine about 15 years ago, anti-aging, the American Academy of Anti-Aging Medicine had about 2,000 members globally. Now it has over 25,000, I think, globally.
Oh, my.
These are we're members as being medical doctors and doctors throughout the world.
Mm-hmm.
And so it just shows you the interest and the expansion of that. But really, anti-aging is really an unfortunate term. It should be healthy aging.
Okay.
Because we all are, like you said.
It sounds redundant, Doctor.
Exactly.
Anti-aging, get out of here. We're all aging by the day, like it or not.
And definitely is. And chronologically, we are all aging. You're born in 53. You're going to be 60 by the time you hit 2013. It's just the way it is.
That's right.
But biological aging is something that we're interested in
Mm-hmm.
medically, which is, can you slow the process down from the health concerns of getting older?
Can you reduce the deterioration?
That's the bottom line. Can you keep the vintage working well?
Yeah.
That's the whole idea.
So graceful or healthy aging would be a much better title for all of this approach, though, wouldn't it?
And not as negative because, it's not about trying to cling to youth that we were 20. It's about being vital as we are now and healthy.
Sure.
Right? And that's really the goal of integrative, integrative age management is part of what we want to do because what are some of the general health concerns as we age? And that's how do we stop those things from progressing in a way that debilitates us or makes us feel old and makes us feel devitalized.
Mm-hmm. Well, many of us, for example, have discovered in recent years that, gosh, we need glasses, even to drive, and you better not be caught driving without them. 5 years ago, glasses, schmasses, who needs them? Hearing and all of it, it's just... There is just an evolution going on here, not the happiest for some of us to recognize, but you're saying that in many cases, the degree of can be reduced in terms of the decline.
Absolutely. Best put into focus is a combination of physiological health, neurological health, mental and emotional health, and also appearance, how you look cosmetically, which is a huge driving force for aging medicine.
Absolutely, and that's what those late-night TV commercials are usually about.
And some of those things do work to a point. That's why Botox is so popular and all those things. And there's a reason for that. But really, all of that's empty unless you're healthy physically as well.
Sure.
A patient of mine years ago, after we worked with her in terms of getting her healthy, getting her hormones balanced, getting her risk factors down in terms of disease, she said to me, I feel great. I feel vital. I feel really wonderful. Yes, I'm 60-something, but I look in the mirror and I look 60-something.
Mm-hmm.
So can I look as well as I feel? Which is maybe reversing herself and saying, can I look as well as I feel because I feel like I'm in my 30s again.
Okay.
So that's why there's a huge evolution with all the cosmetic work that's done. And you can do that with cutting and all the things, but you can do it more naturally as well. You've heard of laser acupuncture. facial lift acupuncture. We have rejuvenescence systems. There's a lot of natural things you can do, but healthy digestive function, healthy lifestyle will lead to better skin. You could do things to enhance it without using as many of the cosmetic procedures, interventional procedures.
This is all part of what Naturopathic Medical Center, the Integrative Center,
Yes.
calls age management.
That's right. It is.
Okay.
So you can do all those things, and it makes a person not look much more vital, look much more useful. It can reduce wrinkles, all those things as well. So that's part of what we do. That's kind of hidden in the back of our facility because we do a lot of that work, but our place is really about managing the risk and reducing the physical debilitation of aging.
One of your colleagues, Dr. Karen Lamb, was with us the last time we had a chance to sit down and talk to the folks at the Integrative Healing Arts. It was in the old days, Dr. Larry. But Dr. Karen does a lot of the rejuvenesce therapies and is one of the lead docs in the clinic in that regard. And she told me point blank that for Asian women particularly, it's really all about the skin. That supple, really youthful looking and feeling, vital looking skin. And she surprised me by telling us in public how old she was, she looked 20 years younger. I'll be honest with you. She was absolutely gorgeous. So the skin, as you just said moments ago, that's the evidence that everything else is okay.
And you've really hit the nail on the head because you understand health as a whole because the skin is the largest organ in the body. So it's going to reflect everything else that's going to be coming up. So if you have poor digestive function, you may get a lot more boils and rashes on your skin as well.
Right.
If you have malnutrition, you can have a lot more, and toxicity, you may have a lot more lines on your skin, a lot more coloration, discoloration. So all those things are important. But there's also tissue wound healing as well. As we get older, we don't heal as fast as we did when we're 10 years old.
Where do age spots come from, Dr. Larry?
It's typically it's lipofuscin. It's actually a browning or oxidation of certain cells in the skin.
Right. Is that an indication that something's wrong, or is that just, hey, you're getting old, too bad?
It's getting old, but again, you can reverse some of that by getting the liver cleansed and getting your system healthier, and some of those age spots will regress.
And Ken, is there, again, I'm going back to those, I watch too much late night TV, which is odd for a guy who works early in the morning. But nonetheless, going back to those ads, one of the things is about age spots. And if you just put this magic cream every night before you go to bed, they'll go away in 2 or 3 weeks. You know the line.
Yeah.
Is there a topical application of something that can, in fact, reduce or eliminate age spots, or are you just stuck with them?
No, some of the creams can help reduce that for sure. The other one, more long-term change would be you can burn them off with lasers as well.
Oh, okay.
But the best way of doing it is by combining that and doing it with making your body and liver healthier as well.
Can you tell, and when you go to the Integrative Naturopathic Medical Center, friends, you better be prepared to spend some time because there's a whole team down there of incredibly gifted, talented, caring people, and they're going to want to get to know you, and they're going to want to get to know your big picture, how you look integratively to all of them. So when you go to an appointment, and suppose you have a specific malady, Dr. Chan, that we want. And I know my doctor, the Western guy from UBC, didn't do anything for me, and it's still driving me crazy. So I'm going to go see one of you alternative guys, to use an old school adjective, right? So they come down and they booked you in, and they're going to go and they're going to see Dr. Larry Chan, and it's my problem. You're not going to want to know just about that problem. Obviously, that's why you're in my office. What's the problem, sir? And then you're going to want to go off on a bit of a tangent and ask a lot of questions. Like what?
Well, the history is very important, and we will look at the past history, but also what is a principal concern. We always mark that first because that is what their mind is.
Sure,
on.
That's why I'm here.
And then there's a lot of background information on family history, lifestyle. All those things are important, and then we do more detailed testing in our clinical testing that gives us a bigger picture of how the organs seem to be functioning in the system and in the body as well. Because if they're coming in with a problem, let's say for joint pain and chronic joint pain.
And in boomers, we experience a lot of chronic joint pain.
Chronic joint pain, it's maybe gout or those kind of pains. as well.
Arthritis, that kind of thing?
Yeah, arthritis. You can have that,
Mm-hmm.
and they're controlled by medication, anti-inflammatories, but they want something more than that. So we may send them to our nutritionist, and the nutritionist will say, well, this diet is highly inflammatory.
Oh, okay.
Look, take some of the, Kirsten can say, take some of these foods out, and we can see improvement in that already just by that alone. And that's long-term improvement and not just masking the problem with medication.
And this is also part of age management too, isn't it? If you adapt your diet to your physical age,
Exactly.
in some cases you're doing yourself a huge favor.
Yeah, you'll be much better. And inflammation then is also an indication not just for pain, but if that joint is actually damaged with osteoarthritis, and the pain is ongoing due to a collapsed joint, we can actually do different therapies with chiropractic or massage. We have people there that could do that as well. And we can also do injection therapies. And some of the injection therapies can help rebuild and regenerate the joint function to a much better place.
But we've talked also about the gradual recognition of naturopathic and traditional Chinese medical practices by the Canadian Western medical community. But in some cases, you have to look over the fence, and that's why you changed the name to Medical Center, because in some cases, those guys, you're going to need a surgeon. You're going to need somebody to go in and actually remove that and do that and fix that, and that's the only remedy, right?
Yes. It's you have to look at the body from a total perspective, because with the same case, you would go back and say, what are all the organs doing? And then from that standpoint, is it a metabolic toxicity issue? And as we age, metabolic toxins are the worst things that build up over time. What I mean by that is that it could be exposure to chemicals, it could be exposure to poor foods, and their liver gets clogged up or the digestive tract isn't working properly, and that builds up and creates more inflammation in the body.
How do we boomers recognize these trends in our body? Because we're a little sensitive, we're a little touchy about this aging thing. We're not all handling it equally well, Larry. So what are we looking for in terms of this buildup of toxins that could really adversely affect us?
The first one is just pain and inflammation, dysfunction, fatigue is a big one. A person feels less vital. That's a big one again, because vitality is a product of your body's ability to produce energy cells. ATP is breaking down.
Okay.
So by limiting toxins, revitalizing the system, you can get much more energy on an ongoing basis.
Okay.
And if the energy is working better, your cells work better, and your cells become healthier.
We need to take a break, but maybe just before we go, as part of this whole dietary and the integrative big picture approach to a person's health, does it happen frequently or from time to time that supplements, minerals or vitamins or certain substances, are the answer?
Very much so, because if you have the right nutrients, you can actually help promote dysfunctional enzyme systems or metabolic systems that have now gone askew. You can put them back on track.
Okay.
And medications like botanical medicines and Chinese medicines can also push organs or support organs. In Western medicine, there's not a lot of thought about. There's intervention, there's crisis intervention, but not a lot of thought about just restoring pathway function and metabolic function or supporting organs. The beauty of Chinese medicine or naturopathic medicine is that we do a lot of organ support and drainage, and that really helps restore vitality in the organs.
Our guest is Dr. Lawrence Chen from the Integrative Naturopathic Medical Center down on West Broadway and online at Integrative.ca. Check the website out. There's an enormous team of incredibly capable people who could really, literally change your life. We're back with more on Boomer Life right after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.